Hi, this is Dr. Sherry Shabowski from MedicalEducationInMinutes.com, and this is another in the classic clinical presentation series that you can find on YouTube. Please like and subscribe for more content. Now, let's meet Philly Amos. Meet Jessica and her 2-year-old son, Philly Amos. The family is happy, healthy, and terrific. Philly Amos is a toddler, just learning to run and climb. He is constantly having little falls and bumps, just like other kids his age. But Philly has a lot of bruises. So Jessica took Philly to the doctor. The doctor examines Philly, and other than the bruises, he appears to be fine. He runs blood tests, including checking his platelets and coagulation factors, and his tests are all normal. This leads the doctor to ask Jessica if she or her husband have any bleeding disorders in the family. She says, "No, we are very healthy." The doctor then calls the police and asks Philly to speak to Officer Friendly. What on earth is going on here? Well, this is hemophilia A, a recessive sex linked disorder. It primarily affects males, leading to a bleeding disorder. Females can be carriers, passing it on to their male progeny. There is no demographic distribution and no racial predisposition and no socioeconomic predisposition for this disease. This is how the sex linked trait is passed on. The abnormal F9 gene is on the X chromosome of the carrier mother, who has no symptoms. She has a 25% risk of having a hemophiliac son and a 25% risk of having a daughter who is a carrier. It is most probable that she got the gene from her hemophiliac father. These are the parents of the female carrier in the last slide. Her dad was hemophiliac. She has one sister, and she is also a carrier. This is an overview of hemostasis. Platelets circulate in the blood inactive. When a vessel is injured, von Willebrand's factor is exposed. Activated platelets stick to the von Willebrand's factor. These platelets call in more platelets that stick to them, ultimately forming a fragile, sticky clot. This is primary hemostasis. The sticky clot carries a negative charge on its surface, which attracts and activates factor 12 or Hogman's factor. This begins the intrinsic coagulation cascade that flows into the common coagulation pathway, ultimately resulting in a stable clot reinforced by fibrin mesh. Here is the coagulation cascade in more detail. The intrinsic pathway is triggered by damage to a blood vessel, which results in a negatively charged sticky clot. The negative charge activates factor 12 and initiates the cascade. The extrinsic pathway is triggered by tissue trauma, infection, or inflammation that activates tissue factor 3. The pathways go through a cascade of factor activations coming together at factor 10, which, when activated, converts prothrombin to thrombin. Thrombin activates fibrinogen to become fibrin, which, when further activated by factor 13, becomes an insoluble cross linked fibrin mesh that reinforces and makes a stable clot. The factor 8, which is reduced in patients with hemophilia A, is a component of the factor 8-9 activation of factor 10, which is the first step in the common coagulation pathway that creates the stable clot. Without factor 8, the factor 10 is not activated as it should be, and this has a large impact, ultimately creating the cross-linked fibrin mesh. This leads to serious bleeding complications. Joint and muscle bleeds are very common in hemophiliacs that cannot form a strong clot. This blood is very destructive to the synovium. When the synovium absorbs the blood and iron, it triggers a pro-inflammatory response. The iron catalyzes the production of iron-free or oxygen-free radicals. Aspiration of blood from the synovial space can usually be beneficial, but in the case of hemophilia, it is contraindicated because the aspiration can cause further bleeding. Minor trauma or strains can lead to significant and painful muscular bleeding. Head injury is especially dangerous because brain bleeds are frequently lethal. If the child is circumcised, they may bleed significantly at that time, therefore helping to make the diagnosis. Dental procedures and surgeries can be very dangerous and need to be managed by pre-treatment with factor 8 and having factor ready for injection during the procedure. Historically, hemophiliacs were given factor 8 concentrate pooled from many people's plasma. Sadly, before the cause of HIV transmission was clear, blood donations were not tested. And since blood was pooled from many sources for factor 8, hemophiliacs unfortunately got HIV from their life-saving factor. Now factor is man-made and the HIV risk has been removed. How is factor 8 dosed? It is based on how much you want to increase the percentage of active circulating factor 8. This decision is going to be based on the severity of the bleeding. For reference, we will attempt to increase the activated factor 8 level by 100% in people with head injuries, which are the most likely to be lethal. Minor bleeds are treated with a dose to increase the circulating level by about 20 to 40%. Depending on the severity of the hemophilia, prophylactic doses are given regularly to prevent bleeding. This emphasizes the importance of the third rule of managing hemorrhage, and that is number 3, correct the coagulopathy. The first two are more obvious: proximal control or pressure to stop the bleeding and replace the losses. But you need to be cognizant that coagulation disorders may be contributing to the hemorrhage. So until you recognize and correct the coagulopathy, the bleeding may continue. Why was the doctor involving the police? Well, Philly Amos had unexplained bruising, and the doctor is a mandated reporter for potential child abuse. His blood tests were normal, and the family did not have a history of bleeding disorders. So child abuse was a reasonable assumption. This illustrates another point, and that is that hemophilia is not only a sex-linked trait that is passed on. It is also possible that hemophilia A may result from a spontaneous point mutation that cannot be predicted. When this occurs, it is not uncommon for the family to wind up having to answer to the Department of Child and Family Services, accused of child abuse. Ultimately, more specific blood tests can make the diagnosis, such as a factor 8 level, and the family reputation is restored. Thank you so much for learning with me today. There is significant content located in lesson form at www.medicaleducationinminutes.com. I hope you are watching this on my YouTube channel, and please like and subscribe. The medical field is an awesome place to use the brain you were given for good. So keep studying, and I'll see you next time.